Hi there, my name's Dave Wood. I work for a company called TTS, or Training and Testing Services. As a respirator face fit testing company, we're often asked a lot of questions about face fit testing. During this video today, what I want to try and do is answer as many of these questions as I possibly can for you. One of the main questions that we get asked a lot is, why do we have to do this? Well, it's quite simple. There are a couple of reasons why we have to carry out face fit testing. One of them is it's a legal requirement. The law demands it. I will talk about a little bit more about what the law demands later on in the video. Secondly, and the most important reason for carrying out face fit testing is to do with people's health. We currently have over 13,000 people a year dying in the UK from respiratory illness which has been caused by workplace exposure. That's 13,000 people a year who are dying as a consequence of doing their job. This is not acceptable in any way, shape or form. We all have this great belief that it's never going to happen to us, it's always going to happen to somebody else. Well, it happens to 13,000 somebodies every single year. I unfortunately have first-hand experience of this. My dad died just over 4 years ago, and he died from cancer. My dad originally was diagnosed with lung cancer over 10 years before he died. The lung cancer he was diagnosed with was attributed back to workplace exposure. I have no doubt in my mind that the secondary cancer which actually killed him over 10 years later was caused by his work. My dad died as a consequence of doing his job. So I fully understand why this is so important and why this has to come to a stop. The legal requirement for face fit testing. The legal requirement comes under certain regulations, COSH being probably one of the main ones. The Control of Substances Hazardous to Health regulations require that all tight-fitting RPEs should be subject to a face fit test to prove that it actually fits the wearer. If the mask doesn't fit, it's going to offer the wearer very little or no protection at all. Face fit testing is also a requirement under the Control of Asbestos regulations, Confined Space regulations, ionising radiation regulations, Control of Lead at Work regulations, etc. The law demands it. People then say, well, why would a mask not fit somebody? The simple truth is we are all wonderfully, beautifully, uniquely different. Not every mask fits every face. It's as simple as that. The masks are all slightly different. They're designed in different ways. They fit in different ways. So if we're going to put a mask on somebody's face, it has to fit them. If it doesn't fit them, it becomes pointless. Also, from an employer's point of view, if you're spending good money on masks, it needs to fit. Otherwise, you're wasting your money. So the reasons for face fit testing are quite simple. The law demands that you do it. Secondly, if we don't, the consequences for that person wearing it could be ultimately we make them extremely ill, or worst case scenario, we in fact kill them. Okay, so the next question is, how do we carry out the face fit test? Quite simply, in the UK, there are two face fit test methods that we use. And those two methods are the qualitative method, which is a simple taste test, or the quantitative method. The most popular method for quantitative testing in the UK is by using the TSI port account. Both of the tests require the test subject to do a series of exercises. The exercises are designed to simulate normal movement during the working day. There are advantages and disadvantages to both methods of testing, but what I'll do is we'll talk about the qualitative method first and then we'll talk about the quantitative method afterwards. So the qualitative test uses a simple test kit. These test kits are relatively cheap to buy. They cost anywhere from about £120 to £170, depending on whose you buy. I obviously would recommend ours because it's fantastic, okay? Inside that kit, regardless of whose it is, we get pretty much similar contents. There is a hood, a couple of nebulizers, some solutions that we use for the test itself, spare parts for the nebulizers, and also instructions for use, okay? The limitations with using the taste test are, we can only use this method of testing on half mask respirators. So a disposable half mask or a reusable half mask. We cannot use the qualitative method for testing a full mask respirator. The reason for this is pretty simple. The problem with this test is it's a subjective test. We are relying on the honesty of the people that we're testing. And unfortunately, not everybody's honest with us. Now, with the qualitative test, there are actually two parts to the test. The first part of the test is called the sensitivity test. Because we're using something that doesn't taste very nice, we have to prove that that person we are testing can actually taste it before we do the test itself. So, before they put their mask on, what we do is we place the hood over their head, we place the nebulizer into the hood, and we spray the sensitivity solution in there. Now, the sensitivity solution is just a weak version of the test solution. So if they can taste that, they can taste the test solution. That's the idea behind it. Once we've established that they can taste the test solution, we then remove the hood from them, we get them to wipe their hands and mouth, and then what we do is we get them to fit their mask. Once the mask is fitted, we will stand there, we will explain the full test and demonstrate the exercises to them. Then what we do is we place the hood back over the head and we do the 7 exercises. Now for the test itself, each exercise lasts for exactly 1 minute on the qualitative test, okay? So when you factor in that you've got 7 1-minute exercises to do, you've got to factor in there's a sensitivity test to do and all the explanation. A qualitative test will take on average around about 20 minutes to complete. That means that most fit testers can do on average about 3 tests an hour. That means over a normal working day, you're probably looking somewhere in the region of about 20 tests. That's what you're looking at. The qualitative test isn't without its problems. We do get issues with sensitivity. Some people can't taste the test solution. We get the problem that we can't test a full mask respirator. We get the problem that it's a subjective test. It is a perfectly valid test. Yep, the HSE approve it, but it does have its limitations. The Porter count machine. The way the Porter count machine works is it's an ambient particle counter. There are 2 tubes coming from the machine. We've got a clear tube which we attach to the mask. If it's a reusable mask, we do that via adapters that we place behind the filters. Or if it's a disposable mask, we basically punch a hole in it and we attach the tube to a metal nipple, okay? So what the machine does, it takes an air sample from inside the mask, it takes an air sample from inside the room, and it works out the difference in the air quality between the 2. And it tells us definitively how well that respirator is performing. It gives us a simple pass or fail criteria. Now, the exercises that we conduct for both tests are exactly the same 7 exercises. The difference on the Porter count machine is we also have to do physical exercise at the same time. And the way that we normally achieve that is we use an aerobic step. The advantages to the Porter count over the qualitative test is it's not subjective. We're not relying on any input from the test subject. Also, we can test the full mask respirator. Also, if the test fails, we can retest somebody straight away. If the test fails on the taste test, we must wait half an hour before we retest that individual. So the taste test, yes, it's a perfectly valid test. However, it does have its problems. Now, as a FaceFit testing company, I'm a great believer that your FaceFit tester should have the ability to perform either test. So they should have both sets of kit with them, okay? The Porter count is the better way. It is the better way of doing things, but sometimes the qualitative test would be the most appropriate method.